wa rahmatullahi ta'ala wa barakatuhu. My mentor in person, Professor Aliyu Umar Muhammad. My fellow colleagues, good morning once again. My name is Abdulrahman Ahmed with Matric Number CPCS/FHS/2025/4662. My topic presentation in this morning is postpartum anxiety. Postpartum anxiety is a mental health condition that affects new mother after childbirth, causing excessive worries, fear and nervousness about the baby, parenting and child life changes. When it is a normal for new mothers to have concern about their newborn. Postpartum anxiety goes beyond typical worries, leading to severe distress and interfering with daily life. Causes of postpartum anxiety. Several factors contribute to postpartum anxiety, including A. Hormonal changes. After childbirth, estrogen and progesterone level drop drastically, which can affect neurotransmitters in the brain and contribute to anxiety. B. Sleeping deprivation. New mothers often experience disrupted sleep, which can heighten stress, irritability, and anxious thought. C. Personal or family history of anxiety. When a woman with a history of anxiety, depression, or other mental health disorder are at a higher risk of developing postpartum anxiety. Stressful life event, financial stress, relationship issues, lack of social support, or previous traumatic birth experience can contribute to postpartum anxiety. E. New motherhood challenges. The responsibility of taking care of a newborn, breastfeeding challenges, or health concern about the baby can trigger excessive worry. 2. Symptoms of postpartum anxiety. Postpartum anxiety manifests in various emotional, physical, and behavioral symptoms. A. Emotional symptoms. Excessive worry, especially about baby health and safety. Persistent fear of making mistakes as a mother. Irrational thoughts or a sense of impending doom. Difficulty relaxing or feeling constantly on edge. B. Physical symptoms. Rapid heartbeat or palpitation. Shortness of breath, dizziness or nausea. Tense muscles or headache. Trouble sleeping even when the baby is sleeping. C. Behavioral symptoms. Avoiding situations or activities due to fear. Constantly checking on the baby excessively. Example, walking the baby to check if they are breathing. Seeking reassurance from other frequently. Difficulty concentrating or making decisions. 3. Type of postpartum disorder. Postpartum anxiety disorder. Postpartum anxiety can present in different forms, including A. Generalized anxiety disorder. Excessive and uncontrollable worry about various aspects of motherhood, such as baby health, feeding, and developmental milestones. Then B. Postpartum panic disorder. Experience sudden and intense panic attack that include physical symptoms like a racing heart, shortness of breath, and dizziness. C. Postpartum obsessive compulsion disorder. Having intrusive distress, thought, or compulsion. Example, checking on the baby repeatedly or avoiding certain tasks due to irrational fears. D. Postpartum traumatic distress disorder, triggered by a traumatic childbirth experience leading to flashback, nightmares, and severe anxiety related to birth processes. We have a difference between postpartum anxiety and postpartum depression. We know postpartum anxiety and postpartum depression are similar. So based on this, there are some little difference between postpartum anxiety and postpartum depression. Under truth, we have under we have three differences: undertone, physical symptoms, and focuses. So undertone, under postpartum anxiety, there is racing, intrusive, and thought. Under postpartum depression, there is negative thought or worthlessness. Under physical symptoms related to postpartum anxiety, there is rapid heartbeat, nausea. Under postpartum depression, there is changes in appetite, sleep problems. Under focus, related to postpartum anxiety, fear of something bad happening, feeling disconnected from the bar. So these are some of the differences between postpartum anxiety and postpartum depression. Then number 5, we have treatment and management of postpartum anxiety. Postpartum anxiety is treatable with professional help and self-care strategies. A, we have therapy. Cognitive behavioral therapy helps reframe anxious thought and develop coping strategies. Exposure therapy, useful for overcoming specific fear and compulsion. B, medication. Selective serotonin reuptake inhibitors such as sertraline and fluoxetine are commonly prescribed for the postpartum anxiety. Then benzodiazepine, used for short-term relief of severe anxiety, but must be taken consciously under medical supervision. Lifestyle changes: healthy diet, eating balanced diet, regulate mood and energy level. Exercise, engaging in light physical exercise such as walking or yoga to reduce stress. Then adequate sleep, creating a sleep schedule and seeking support from a partner or family to rest. Relaxation technique, practicing deep breathing, meditation, or mindfulness. D, social support, taking to beloved ones about feeling, joining postpartum support group, seeking professional help when needed. When C, 6, when to seek sleep. Mother should seek professional help if anxiety interfere with daily life and ability to take care for the baby. Then symptoms persist for more than 2 weeks. They experience panic attack or obsession thoughts. There are thoughts of self-harm or harming the baby. Emergency medical attention is needed. Conclusion: postpartum anxiety is a serious but treatable condition that affect many new mothers. Recognize the symptoms, seeking professional support, and adopting self-care strategies can help mother recover and enjoy motherhood. Awareness and early intervention are the key to preventing long-term mental health struggles. So these are some of the reference behind. So thank you very much for listening.